Ready? Okay. Welcome everyone and good evening. My name is Sue Full and I work at the PKD Foundation, and it's my privilege to be here with you guys tonight as your hospitality host. I will be asking that everybody mutes their camera or mutes their microphones. Feel free to leave on your camera or turn it off, whichever you prefer. If you have questions, if you could just put those in the chat during the presentation. I will be monitoring all the questions and we will be saving those for Q&A at the end of the presentation. We cannot answer medical questions, so if there are specific medical questions, we would ask that you consult your physician for those. And with that, I'd like to turn the presentation over to Helen Christensen. She is a registered nurse and has worked in the space for many, many years, and she right now is working with living donor transplants and navigating patients through that process. Thank you for being with us, Helen.
Thank you. And I'm out in lovely California where it's, what time is it? 3:17. So we can do a time check later. I was like, who's who and where are we? So, well, thank you very much. I'm excited to do this presentation and to talk with you about what to expect after that exciting time of post-transplant. So I do have a, let's see if we can get the slides to work. All right, they worked just a moment ago. So, aha, all right. So I know that you probably have seen this on multiple, but here's the activity disclaimer. And as Sue said, I'm not your physician. I am a nurse at UCSF. And so if you have questions about your specific health, you definitely need to talk to your own provider. So thank you on that one. I don't have anything to disclose. So let's get right to it. As I said, I am from UCSF. And I wanted to hit on this. Interestingly enough, during COVID times in the pandemic, we have adjusted our visiting policies. And funny enough, this morning we got a new update. So if you are called in for transplant, probably to any transplant center in the next coming, probably through the end of the year, check on what is their visiting policy at this time, because it has changed dramatically over the course of time. And something that we will continue to do is the telehealth visits, and I'm sure that other transplant centers are doing the same thing to, keep our patients as safe as possible. So I wanted to just, some of the things that we're doing to keep you safe is really minimizing our face-to-face visits. And so your initial visit to UCSF may be virtual, maybe through telehealth. We are still suggesting the social distancing and keeping 6 feet apart. We also are still having people who come in wear masks. And I think that that will be an ongoing safety precaution that we will be using. And we are also limiting the amount of people that are in our waiting room. We've set aside some of the chairs. Probably if you've been to any doctor's office in the last 15 months, some of the chairs in the doctor's office are blocked off so that we can keep up with the social distancing. We do a lot of screening and testing, and you will do some symptom screening and testing preoperatively. So if you get the call to be brought in for transplant, you will be tested to make sure that it is safe for you to proceed. Okay, there we go. A little bit, we're going to go into detail on a lot of these things, but I think it's always important that we really keep track of how many people are waiting, which is, my plug for if you have a living donor, it's going to help you get transplanted so much sooner. I think that right now, the 93,000 people waiting in the United States for a kidney transplant, and at UCSF, we have about 4,800 people that are listed for transplant. So it is really, sad to say, a living donor will help you to get to transplant that much more quickly. You will be evaluated for transplant, and we'll talk a little bit more about that. So as you've gone through the process, at whatever point you are in the evaluation of the listing process, each transplant center does their program a little bit differently. At UCSF, we have you do some initial screening, but understanding that you are going to be on the list for, if you don't have a living donor and you're waiting for a deceased donor, you're going to be on the list for a length of time. We don't do a full workup at that point. So again, you would check in with your own transplant center as to how, what's their process, how much evaluation do you have? If you are able to get transplanted, you're in the hospital for about 3 to 5 days. We will talk a lot about the new medications. This is probably the biggest issue, and the thing that you need to pay the most attention to after you get transplanted is really adhering and making sure that you follow the directions on when do you take medicines, and we'll talk a little bit more about that. Our clinic appointments, when you are newly transplanted, you will come and be seen in our clinic. We always ask you to please get your labs done prior to the visit, because we're going to discuss your lab results during that time. And then you'll see your provider, and we will discuss your labs, and we will, they will sit and they will talk with you about what's going on for you. How are you adjusting what's going on? And then life after transplant, this is going to be one of my fun slides, is that, the importance of food and exercise and work and family, and really embracing and taking best care of yourself, and really enjoying this new opportunity that you have. So, as you know, with kidney failure, there are some options of how to address that. And I don't know if you might be on dialysis now, you might be on peritoneal dialysis, you might be on hemodialysis, you might be doing dialysis at home or in a clinic or in a dialysis center. Treatments for kidney failure would be, one of them would also be transplantation, either through a deceased donor kidney or through a living donor kidney. And we can talk more about how that all works if you'd like. Living donor kidneys do seem to last longer. And so on this graph, you can see, and hopefully you can see the colors on the far left is green, which is a standard criteria donor kidney. And it lasts somewhere, this is a little bit old data, but somewhere around 10 to 14 years. And a living donor kidney would last somewhere on average, again, well matched, 17 to 28 years. In fact, I've had patients that, they've had their kidney, for 25, 30 years, and it's still functioning and it's still doing really well. And so that's amazing. And part of it really is adhering and taking best care of yourself and really following the directions of the healthcare team. And we'll talk about who all is on your team. So a little bit about the transplant hospitalization. If you have a living donor transplant, we are actually going to plan for when you're going to be in the hospital. And so the process is really dependent on the donor getting through all of their testing and getting through their testing safely. My response to patients is how long this will take. It's safely and quickly, always most important, being safely and making sure that that donor is healthy enough today and would be healthy enough long-term, and of course understands what is happening. So the donor is admitted on the morning of surgery, and they are typically in the hospital about 2 to 3 days and go home. Now, for a deceased donor transplant, again, we can't plan ahead for this because we don't know when the deceased donor offer is going to be called in or come in. You will be called for admission when the kidney is identified. So it is really important that you accept phone calls. I know that sometimes it's hard when you get a phone call and you don't know the number. I tell our patients that, if you get a call from our area code and these first few digits, pick it up, or always screen your calls so that if you're going to screen them and you're going to call that person back immediately. Because really, we do want to, if we have a kidney available to you, we do want to give it to you. We do want you to be ready for it. So it is really important that you answer calls, or if you are screening calls, that you listen to the voicemails very quickly afterwards so that we can discuss with you if this is the best kidney for you. It is also important to know that we call this a sleepy kidney. About 25%, so maybe 1 in 4 thereabouts, kidneys may not function immediately. And so you might be on dialysis for a short period of time, even after you've gotten the kidney transplant. And your hospital stay is going to be about 3 to 5 days. And I think the other thing that's very interesting, and again, it depends on, especially because patients that have polycystic kidney disease, sometimes their kidneys will be removed, their native kidneys will be removed, and sometimes they won't. So this is a picture of somebody who did not need to have their kidneys removed as part of their transplant experience. And the new kidney, the donated kidney, is placed in the lower abdomen. So in these cases, we wouldn't take those the other kidneys out. Again, it's a clinical decision depending on you, and it's made with your surgeon as to should the kidneys, your own kidneys, be removed, or are they going to stay in place. But this is just a picture of this is where it is logistically in your body after the transplant. A little bit about our clinic. So when you come to our clinic, it's 400 per analysis. You will have labs done, especially in the very beginning, and you will have labs done twice a week. And then they do eventually, as long as everything is stable, you will eventually be able to have them phased out, never completely, but certainly less frequently than in the very beginning. You will have clinic visits. And again, in the very new post-operative period of time, you will be coming to the clinic every single week. And again, as long as things are stable, those will also decrease in frequency so that you won't be coming every week. Eventually, you'll really only be coming maybe once or twice a year. You'll see one of the providers. An APP is an advanced practice provider. So that could be a nurse practitioner, it could be a physician's assistant, or you'll see one of our physician team. Notice that first thing on the list is review your medications. We really want you to be experts at your medications because that's how important they are. We will also review your labs. And again, as I said, they're going to sit with you and it's like, what problems are you having? What speed bumps do you have? How can we help you to be as successful as a post-transplant candidate as you can possibly be? So we do have some responsibilities for you. Some of our labs, and we'll talk a bit more about in depth about labs and medications. So between the period of when you first get transplanted and 30 days, you're going to have labs twice a week, and you'll be coming to clinic visits once a week. And again, it all depends. Obviously, if there's complications, if there's issues, then it might be more frequent, but this is in general speaking. If you are 31 days to 90 days after your transplant, you'll still have labs once a week, and you'll get to come to see us every other week. Again, we've pointed out we have a large portion of our patients are Kaiser patients. And so at 90 days, they are then transitioned back to Kaiser, and Kaiser is going to be taking care of them. We'll talk about this again later, but it's very important that you know that your primary care physician is still going to be taking care of everything else for you. So your primary care physician is your primary care physician. The kidney physicians, the nephrologists at UCSF and at transplant centers are here to manage your transplant experience. And I think that it's great when you get to that bottom rung there, you're 36 months from your transplant, so 3 years out, and to forever, you will be having labs at least every 3 months, and you will come to visit us in clinic every 6 to 12 months. And as a reminder, you're coming to see us for your kidney transplant, And the rest of your primary care is handled by your primary care physician. So the first few visits, again, number one on the list, as you can see, is review your medications. In our hospital, we give you a green cardboard medication form so that you can keep track of what your medications are. We have you bring that with you every time you come to clinic. We have you write in pencil, so that way you can erase and put it on, put whatever new medications or new timing or etc. Again, we're going to review your lab results, address your concerns, your problems, your questions. So these first few visits really are, okay, here's what's going on. And if you have staples, if you have drains, if you still have a catheter, those will be removed at some point during these first few visits when you come to see us after transplant. Now, as I said, taking your medications, it's so important. And understanding that taking your medications may also mean that you're going to have some side effects. If you have side effects and they're causing you to say, I'm not sure if I can take my meds today, you absolutely need to give us a call. You absolutely, because if you're not able to take your medications, then that's a very big concern. So anytime you have, if you're having these kind of complications or side effects, and it's making you either not able to take your medicine, thinking about not taking your medicine, you really need to call your transplant center. So these are very common, the GI, the possible tremors, some hair loss, a little bit of edema. Even if you're taking your medicines, because we are immunosuppressing, so we're tamping down your immune system, it means that you are going to be a little bit higher risk for viruses, for fungal, for bacterial infections, for sometimes cancer. Traditionally or predominantly it's skin cancer. But again, you need to take these medicines for the rest of your life to be able to protect your kidney. And then another thing that's kind of, I know, always a concern for our patients is rejection. As soon as you hear rejection, you think, oh my gosh, that's it. What I want to remind you is that 10% of patients have, less than 10% have an acute rejection. And even if you have a rejection, it doesn't mean that you are going to lose your kidney. It means, as you're taking your medicines, if you're, taking them every time, all exactly, then, your chance of rejection is less. But again, if you start having rejection, the sooner that we find it, because your clinical, your lab results are off, the sooner we can see that, the sooner we will be able to either treat you with steroids or IVIG or whatever is needed to be able to get you on a smoother path. This is one of my favorite slides, and where you see the next one coming, it's another one of those. Diet and foods. There are certain foods that you need to avoid because of how they interact with the medicines. And keeping in mind, your diabetes doesn't go away. Your high blood pressure doesn't go away. If you're lactose intolerant, that doesn't go away because you got a kidney transplant. If you are on special diets to help you with any of those issues, you need to continue on those kind of diets. Even though food tastes great, you still need to adhere to some of those kind of diets. There are some foods that interfere with drug metabolism. So grapefruit, pomegranate, and I was surprised by this, mandarin oranges. I don't know what's in them, but that's, again, foods that you would need to avoid. And then foods that you need to avoid because of the risk of infection. So sushi, raw meat, raw eggs, or unpasteurized dairy products. All of those pose a risk for infection. And again, we've suppressed your immune system. So we want to make sure that you avoid those things so that we don't have to worry about you getting an infection from one of these foods. So my favorite part on here is weight gain is common post-transplant. there's less food restriction, and food tastes better. So we do expect that you are going to possibly gain some weight. And so then there's a great list on the right-hand side of all the calorie burning activities that you can be counting on. What I love is that I'm going to burn more calories sleeping probably than my 30-minute walk this morning. So again, it's paying attention to the balance of those things. So take a minute, take a look at that list and say, okay, is there anything on here that you say that jumps out to you that says, oh, I need to do more of that? And please, I really don't think that you're going to want to rearrange the furniture 30 minutes every day. I don't think that your family could say, wow, what are they doing now? Burning 195 calories. So keeping in mind, we expect you might gain some weight, and we do want you to continue to take best care of yourself. Now, there are some of you that might be wondering, can I get pregnant after kidney transplant? We do ask that you wait at least a year after getting your transplant before starting the process to be able to get pregnant. We also want to make sure that you have stable kidney function. It's very important that you're on a nice, smooth path before we have you introduce pregnancy as another pathway. We'd want to make sure that you haven't had any rejection episodes and that your blood pressure is controlled, because during pregnancy, your blood pressure will go up usually. So we do want to make sure that that is under control. And you may need to have your medications adjusted. So again, you might be in more contact with us at UCSF or your transplant center after you've gotten pregnant. So most pregnancies of transplant recipients are delivered somewhere between 32 and 36 weeks. You do have a little bit of an increased risk for preeclampsia, which might mean that your blood pressure goes up, or you might have protein in your urine. Your OBGYN will most likely want to monitor you more closely than their traditional patients. So just keep those things in mind. There isn't any reason to do a C-section just because you're a transplant recipient. However, if it is indicated, obviously, then your OBGYN would do that. It is okay to breastfeed as a recipient. And there's no problems that have been identified that are born to transplant recipients. So that's great news. Okay, so as I've said, your primary care physician is really going to be monitoring your overall health. And things that they will be considering and monitoring more is your cholesterol. They will probably be talking to you about exercise. It doesn't mean that you have to go and run a marathon. It does mean that we do want you up and moving and being as active as possible. Fitness and weight, eat healthy and exercise. Again, taking best care of yourself. That'll also help you with your bone health. We do monitor your calcium and your phosphorus. And look at that, exercise comes out 3 times. I wonder what we want you to do, exercise. Health maintenance, again, it's very important that you get vaccines, health maintenance exams like your colonoscopy, a pap smear, a mammogram, your PSA, all of those things have at least as much influence on your ongoing health as being a transplant recipient. So we do want you to always be in touch with your primary care physician and making sure that if there is health maintenance exams that you need or vaccines, that you are tagged in so that you will get those in a timely manner. Like everything, it takes a team. So our transplant team manages your immunosuppression. We take care of any transplant-related problems. And as I've said multiple times, we're not your primary care physicians. You will continue seeing your primary care physician for your health maintenance, for your vaccines, and your primary care issues. You might also still be working with your nephrologist, and they work along with us on the transplant team. And then, of course, there's any number of other specialists that you might be involved with as you go through this process. So we are going to talk a little bit about medication adherence. So following the medication requests, following the prescription, and making sure that you are really following exactly when you're supposed to be taking them, what you take them with, time of day. So the immunosuppression, so the lowering of your immune system, helps to prevent rejection. It is life-saving and lifelong medications. It does help you keep your kidney alive and functioning, and that's why it's such an important whole part of this whole process. Strict adherence is the key to success. We'll talk a few different ideas of how you can make sure that you're taking your medications the way you're supposed to. Don't forget to take your medicines. So whatever you need to do, we'll have some ideas of things that help you to remember to do them. And also make sure you're not going to run out. At least a week before your prescription, you're running out of your prescription, get those prescriptions refilled so that there isn't any drop in being able to take your medicines. If you have any issues, you just call us. We will help you with getting refills, and we can get our finance people to help you with how can you afford the medications and such. Please do not skip or miss doses. Take them as prescribed, and timing matters, and we'll talk a little bit more about that. So this next slide is a little busy. However, I think the key items here, so creating a routine, taking your medication with an activity. Now, for me, I have meds that I have to take in the morning. So if I'm brushing my teeth, that means I'm taking my medicines. If there's a certain time that you need to take it sometime in the middle of the day, it's like, okay, at lunch, this is what I do. I have my meal, I take my meds. Whatever you can do to make a routine so that you are taking them at the same time every day. Set an alarm. I mean, there's so many different alarms. We all have all these different pieces of equipment. I'm just looking around. Set an alarm on your phone. Set an alarm on your computer. Whatever you need to do so that you're not going to forget. Because like all of us, you're getting along. You're doing things. And it may slip your mind. And that's really, it's so important to be taking your medicines. Use a pill box. You can start you just set out your meds for the whole week. This is a great reminder of, okay, first of all, during the pandemic, have we not all forgotten what day of the week it is? Use your pill box. That'll help you to remember what day of the week is it today. And then it'll also help you remind you that, did I take my meds today? Oh, yes, that section is empty. Today is Friday. I took my meds already. Carry extra doses with you. If you're out, and something happens and you can't get home to take your noon medication, take your medication, take some meds with you so that you're always taking them at the same time. Or if you stay with different caregivers, take some medicine at everybody's house so that you're, again, never in that position where it's like, oh my gosh, I don't have my X. Now what do? Like, always have it with you. I think transplant teaches us all that you really need to prepare ahead. You need to be a planner, and you need to set up things so that you are taking best care of yourself. Keep them visible. If you, again, it depends on your living situation. So obviously, if you have small children, you have pets, you have whatever, you don't want to have them where they can be, picked up by small children or by pets. However, if you are able to put them out so that you can see them, because again, you do more of what you see. So if you've got them right in front of you, it's a lot easier to remember to take your medications. Do you need Post-its? Whatever will work. This one here where you put the pill upside down, if you've taken the medicine, that's another what works for you. If you're somebody who likes Excel spreadsheets, this is perfect. You can record each dose. You can set up an Excel spreadsheet with all your medications and when they need to be taken. And if you're like me, I love check marks. Put a little check mark. Yes, I took my meds today. So again, there's a lot of different options.
Helen, I wanted to just let you know we have 15 minutes left.
Okay, thank you.
Mm-hmm.
Another thing, and again, if you are tech savvy and you really like apps, there's a lot of different applications that will help you with remembering to take your medications. I would check with, if you have Kaiser, check with your Kaiser team. Look at Transplant Hero, AlloCare. You can check with the pharmacy where you get your medications. So again, kind of get out there and look and see what would be. And if you haven't been transplanted yet, now's a great time to get, all these resources lined up so that when you do get the call, you can just automatically be ready for whatever comes along. And I think you probably have heard me say this enough times today, but the medication timing is very important. There are certain medicines that require that we, if they should be 12 hours apart. So figure out if you're a night owl and you're up at 2 in the morning and you take your medicines at 2 in the morning, well, then that means at 2 in the afternoon if they're 12-hour. So again, adjust it to what works for you. And this B before D, blood before drug. So if you're going to get your labs done, you should get your labs done before you're taking medication. So when you make your lab appointment, allow for how long is it going to take at the lab, and then I need to take my medications. Again, always making sure that you're doing everything that you need to be able to get your medications on at the right time. It's also very important that if you are, obviously you're taking medications for immunosuppression. If you take any other medications, make sure that the transplant team knows that you're taking them, and know that some medicines might interfere with your anti-rejection meds, your immunosuppression. So really is it very important that we know what you're taking to make sure that it's not going to have any effect on your transplant medications. And then I love this next one. So this is, a lot of us take generic meds. And so the form of the medication may be different depending on who the manufacturer is. So as you can see, that lineup of medications at the bottom is all tacrolimus 1 milligram. They all look slightly different, but each one of them is the same pill, the same medication. So if you get your medications and you say, these don't look right, they don't look the same, check with a pharmacist when you go. Or if you ever have any questions, give us a call at the Transplant Center. Generics are equally safe and effective as their brand counterparts. But again, we want you to be the best advocate for yourself. So knowing when to take your medications, know what other meds you're taking and if they're causing any problems, and what do your medications look like so that you can be the best advocate for yourself. We're going to move on to our social work team. And as I said, it takes a team. So our social workers will be available to you and they can help you with, are you having issues with your insurance? Can they help you with, finding different insurance? Are there, we call it adherence barriers to post-transplant. Are you having issues with being able to take care of yourself in that post-transplant world? Let your social worker know, let the team know so that we can help you to be as successful as possible. They're also great at communicating between the outpatient clinic team, the pharmacy, insurance issues. They'll also help you with medical information forms, for disability or for family leave applications. And then they can also provide some referrals to community resources, so mental health support, transportation, finance, benefits, substance abuse, housing. Now, they can't find you housing, but they might be able to put you in touch with someone who has more information about housing or substance abuse, etc. They also are there for the emotional support of the adjustment to transplant or some of the psychosocial side effects from the medication. As I said in the
5 minutes remaining.
Okay, as I mentioned in the very beginning, check if you are called to go to the hospital, check in with your hospital as to what the visitor policy is currently because of the epidemic. So that's, these may have been changed. As I mentioned, we updated our visitor policy today. So these might actually be outdated because things changed today. I think I have saved 9 minutes for questions. I'm going to stop sharing my screen. Do we have any questions?
Helen, we sure do.
Okay.
We have quite a few questions about paired exchange. And The first one is, where should people look first for looking into that? Is there like a national place to look, or would you just go to your transplant center? And then there was a specific question about paired exchange at UCSF.
Oh, fantastic. Thank you. Let's see. So yes, I would first of all talk with your transplant center about how they take care of and address if you have a donor that's not a match for you. And so for UCSF, we have an internal a paired exchange program, but we also work with the National Kidney Registry. And so I love it. If I have people who come in and they're not a good match for their recipient, we have that other option. And we do talk to all of our recipients here about paired exchange, and all of our donors hear about paired exchange, because we don't know as they come through the system, are they able to donate directly or not? So it is something that we do bring up to all of our patients.
Great. We have a couple here about travel, which I'm guessing people are wanting to know how far they can travel from their transplant center after donation. I'm guessing probably also time after donation. And then also the other question is, what about going to other countries?
I think that definitely you would want to wait until you're stable. I would check with your specific transplant center as to what are their restrictions. But again, we wouldn't want you traveling until we were sure that your medication regime was stable and that you were able to adhere to it. And will you, heaven forbid, that you need any medical care in the country where you're going, will you have access to medical care when you're there?
Great. They're wondering if there's an age restriction to be a living donor.
For our program, and again, different programs have different, if it's somebody that knows you, then the minimum age is 18. If we have a non-directed donor, so somebody who just saw something on a TV show, then they need to be at least 21. I know that other centers, if you're a non-directed donor, then their starting age is 25. The upper age limit really depends. Yes, you have to be, this is always the thing, you have to be healthy enough today and long term. And that's my job, to make sure that I'm not putting you at undue risk. So, you know, there are people that are, say 40 and have multiple health issues. There's people that are 70 and don't take any medications for anything and are active in everything else and have great kidney function. So it's one of those where it all depends.
Thank you. There's another question about, what can you say about vaccines after transplant? Do they work as well?
You know, that's been, especially during the pandemic and everybody, you know, should I get the shot? Should I not get the shot? We have encouraged all of our recipients to get vaccinated when it's available. And I think that there's still research being done as to, you know, for all of us, are we going to, any of us, we're going to need a booster shot at some point. But we know that the vaccine is recommended for our recipients. And then the other thing is, like, especially during this period of time, we would recommend continue to, you know, hand washing. Hello, we've all heard that forever, right? And ever so much more now. Hand washing is huge. Continue. If you feel more comfortable wearing a mask, wear a mask. I mean, if I'm going to the farmer's market, and even if it's outside, I'm probably going to still wear a mask, because if it's a crowd, it's like, I'm fully vaccinated. I know that I'm protected. I think I'm going to just give myself that little extra, you know, protection. And I would expect that recipients, you know, go that same range.
Mm-hmm. That sounds great. Here's one about lifestyle changes. Should people anticipate any lifestyle changes after transplant?
Well,
maybe because of infection, risk of infection or medications, et cetera.
Well, I think that medication wise, I mean, you're immunosuppressed. So it is one of those things where you have to think about, you know, yes, all of those babies are really cute. And, you know, how can you make sure that you're able to take best care of yourself? And then, you know, and again, if you're with somebody who's not feeling well, I mean, this is the thing, none of us had colds during this last year and a half. Part of it is that, you know, we didn't get to go anywhere. But, you know, part of it really is just using those, you know, basics, wash your hands. If somebody's coughing, step away from them. You know, it's just all of those things that we probably have known all along and has really hit us over the head over the last year and a half.
This is true. What about pets and if you should have them post-transplant?
I really don't have an answer for that. I know that there's issues with cat litter, but I'm sorry, I don't really have an answer for that one.
Okay. One of the things I did want to mention that was brought up earlier in the chat is, could you address the fact that there's different waiting periods throughout the country, that not all of them are as long as some post?
As ours? Yes. Well, so this is the thing. I always recommend go and see what the outcomes are for each of the transplant centers. So first of all, what transplant center will your insurance company allow you to go to? Look at the data for each one of the transplant centers, not only how long is your wait time, but how many transplants do you do and what are your outcomes? And yes, there's a huge variety of wait times throughout the country. So those are things that, you know, make sure that you are looking at all of those data points and deciding, where do I want to go for my transplant care?
Great. I have two more I'm going to try to squeak in.
Okay.
I do want to remind everybody while I'm talking that there is, before you X out of this session, if you could take the survey, that would be great. But there's two more great questions. Are there any signs or symptoms a caregiver should be aware of or concerned of if they notice? I guess for the caregivers out there, what should they be looking for and when should they be worried?
So I think any time that you have a change in, especially if you have a change in behavior of, we're talking about the recipients. So if there's, you know, if they have a fever, if they are not as active as the person was before, if they have a change in their diet, if they aren't peeing as much as they used to. So all of those things that if there's a change, it's like, okay, always call the clinic. If you're concerned, call the clinic. Err on the side of call the clinic.
I've heard that. Always call. Always call.
And
then there's a lot of initials in this, so bear with me. Can you discuss the different types of deceased donor kidneys, such as CDC, CBC, EDC, SDC?
Okay, so we're talking about standard criteria donor. So I think that we have a little alphabet soup going.
Okay.
So standard criteria donor is typically a donor that is maybe a little bit younger, so younger than 40 or 50, 60, something like that. And they have less issues with their kidney. Okay, so somebody that is 70 years old and a donor is going to, you know, it's like they might have had high blood pressure, so their kidney is not going to be as structurally bold, if you will, as a standard criteria donor. There's been a lot of changes in the way that we describe kidneys. We've talked before about increased risk kidneys and PD unblock, and you know, so it's an ever-changing alphabet soup. We will talk to you about, you know, what do we know about the kidney if it comes from a deceased donor. We will be able to talk to you about a little bit of information about what we know about the donor.
And I guess the follow-up to that, which I'm going to say probably errs on the side of medical advice, but when you should accept a kidney that maybe isn't the most perfect kidney, that's probably a discussion with your transplant coordinator.
Absolutely, absolutely. Yeah, we are always going to look for the best kidney for you, no matter what. We're going to look for the best kidney.
That sounds great. Well, thank you so much, Helen.